So here I am your Arka Sir. So I have come with a new, fresh and new episode on topic biology. So if you have missed my previous episode, you can go through the topic where I have discussed many things. Clear? In my previous episode, I have discussed about the different type of blood pressure. Okay, and how we can measure the cardiac output. Clear? So that I have discussed in detail. So if you have missed, you can see all the episodes which I have uploaded. So it will definitely help you in your board examinations of class 10 or class 12, as well as your joint entrance examination or NEET examination. Joint means the NEET, clear, for the medical students. Okay. So today we will move ahead. So the physiological variation of blood pressure. Okay. So how the blood pressure can vary. Clear? So before we start this, so two more type of blood pressures are there. It may also come in the NEET examination. Okay. What is that? One is known as casual blood pressure. Casual blood pressure. What is the casual blood pressure? Anytime, casually, we are measuring the blood pressure. So if the blood pressure is measured at any time, so that is known as what? Casual blood pressure. We are empty stomach, we are sick, or we are taking food. After that taking food, okay, that doesn't matter. Clear? So at any time, if we are measuring the blood at random, blood pressure at random, then that is known as casual blood pressure. So if the blood pressure is measured at any time, then that is known as casual blood pressure. Clear? Next one is basal blood pressure. Okay, next one is basal blood pressure. Clear? So basal blood pressure means what? After taking food and taking rest of 10 to 12 hours, okay, totally physically and mentally taking rest, okay, then the blood pressure is measured, is known as the basal blood pressure. Taking food, we are going to take rest completely, physically and mentally. Clear? In that condition, after 10 to 12 hours, in that condition, complete resting condition, both physically and mentally, both. Clear? Then if the blood pressure is measured, then that is known as the basal blood pressure. So after taking rest for 10 to 12 hours, both mentally and physically, the blood pressure measured is known as basal blood pressure. Clear? Blood pressure. So these two also terms are important for the NEET examination also. Clear? That's why I have given the casual blood pressure and what is basal blood pressure. Casual blood pressure means anytime I can measure the blood pressure, systolic and diastolic pressure. Clear? So that is known as the casual blood pressure. And basal blood pressure, I am taking rest completely. Okay, both mentally and physically. Clear? Completely. That means physically I am not doing any work, but mentally I am doing a sum, or I am thinking something. So that will not be done. Clear? So both mentally and physically rest. Okay, after 10 to 12 hours. Okay, in that condition only, what the blood pressure we are measuring, systolic and diastolic. So that is known as what? Basal blood pressure. Now let us discuss the physiological variation of blood pressure. Means why the blood pressure varies, okay, physiologically. Okay, so first Let us now discuss the physiological variation of blood pressure. Clear? So how and why the blood pressure varies? Okay. So first one is age. Clear? So in case of when the age will grow to the older age, then the blood pressure, especially the systolic pressure will increase, okay, as the elasticity of the wall of arteries will damage and the wall of arteries will be rigid. So what will happen? It can't expand and the systolic pressure will increase. Clear? So that means what? In case of the older ages, what will happen? Suppose in normal blood, suppose the arteries, okay, when the blood is flowing and give a pressure, so it can expand also, okay, it can expand like this when the blood is giving a pressure. Clear? Because the elasticity property is there, okay, it will not be rigid. It is just like a rubber. Elasticity property is there. So when the blood will flow with a high speed, then also it will be expanded and it will minimize the blood pressure. Okay. But in case of the older people, what will happen? This wall of the artery will be rigid. Okay. And the expansion property, elasticity property will destroy. Clear? Not be expanded much. So what will happen? When the blood will give a pressure, no space is there available. So what will happen? As a result, what will happen? The blood pressure, the systolic pressure will also increase. So as the age will grow, okay, basically the systolic pressure will increase. Clear? So that is the first factor of the variation of blood pressure. Okay. So due to the rigidity of the wall of the arteries, as well as due to the destroying of the elasticity property of the wall of the arteries, what will happen? The blood pressure, especially the systolic pressure, will increase than the diastolic pressure. Okay, in compare with respect to the diastolic pressure. Okay, so this is the first condition. So second one is sex condition. Okay, that means sex means male or female. Clear? So male or female. Clear? Basically, okay, the blood pressure up to 50 to 65 years, up to 50 or 65 years, basically it may be different from patient to patient. Okay, the blood pressure of female will be lesser than male. Clear? Female will be lesser than male. Basically, before the menopause, actually, okay, the menstruation cycle, okay, will be continued. So the blood pressure compared to male, in case of the female, will be little bit lower. Okay, but the male will be higher. But when the menopause occurs and the age will grow, then the blood pressure for both male and female will be almost similar. Clear? So up to the menopause time, okay, as the menstruation cycle will be there, that's why the blood pressure of the female, okay, will be lesser, a little bit lesser, not too much, little bit lesser than male, but after that, okay, it will be almost same, okay, with compared to the male. As the blood pressure of the female are lesser than male up to the menopause time, so that's why basically the lifespan of female is a little bit more than male. It is in general, but there are exception also, okay. So it is in general. So that's why the sex blood pressure will also depends on sex. Clear? In case of the female, up to the menopause time, the blood pressure will be slightly lower than the male, and in case of the male, it will be slightly okay upper than or more than the female. Okay. So that is the second point. Now the third point. I am rubbing this. Okay. So third point is body structure. Clear? Third point is what? Body structure. Body structure. If you are fatty, then what will happen? The blood pressure will generally will be higher. Okay, they will compare to the normal. Okay, weighted persons. Clear? So the systolic blood pressure will be slightly higher in case of fatty body structure. Clear? Next what? Posture means you are standing or you are lying. When we are standing, then what will happen? The blood pressure will be slightly higher, okay, because the blood have to send to the anti-gravity. Clear? When it is entering in the arteries, okay, from the ventricles. Clear? So but when you are lying, the blood pressure will be slightly it will decrease slightly, okay. So what will happen? The blood pressure will slightly higher when we are standing, and will be slightly decreased when we are lying or sleeping. Clear? Next, when you are lying or sleeping. Clear? So this is the body structure, posture. Okay. So basically these are the key points on which. So basically these are the key points on which, okay, the blood pressure, okay, depends. Clear? Okay. Clear? So now the thing is that this is the posture. Okay. So few more are there. One is say food. Basically after taking food, the systolic pressure may increase a little. Okay, after taking food, the systolic pressure may increase a little. Clear? Then excitement. Clear? In case of the excitement, okay, systolic pressure may increase a little. Clear? So basically these are the factors on which the physiological variations or factors on which the blood pressure depends. So first one is the age, second one is the sex, third one is the body structure, posture, food, excitement or emotions. Clear? So all are the parameters on which the blood pressure depends. Clear? May vary. Okay. So hope you have understood this. Clear? Now let us move to the next topic. Okay students, so now let us move to the measurement of blood pressure. Okay, measurement of blood pressure. Okay, so the instrument, indirectly we can measure the blood pressure, okay, through the instrument which is known as sphygmomanometer. Okay, sphygmomanometer. Clear? That in the chemist shop or at your home also. Clear? Today the digital things is available. Clear? In the previously it was manual. Clear? In the doctor's clinic, nursing home, hospitals, that you are very much found out that you are familiar with this. Clear? The instrument it is known as sphygmomanometer, and the artery, where the artery is known as brachial artery. Okay, the brachial artery of our hand. Clear? So we are taking the blood pressure from that brachial artery, and the instrument is known as sphygmomanometer. Clear? So the brachial, which artery is used to measure the blood pressure? Brachial artery of our hand. Clear? And the instrument is known as sphygmomanometer. Clear? Now let us start electrocardiogram. ECG. Okay. So basically what we know, the impulses are generated by our heart muscles. Clear? So if we plot the impulse on a paper, clear, then the graph we get is known as electrocardiograph. Clear? So if we draw the impulses of our heart muscles, okay, electroimpulses of our heart muscles on a paper, then the graph we get is known as electrocardiograph. And the instrument is known as electrocardiogram. Clear? So the ECG, clear, there are some sensors are there that will be fixed, okay, with the help of some jelly type thing, okay, on our heart at the different point. Clear? So it will take the impulses, electro impulses that will be generated by our heart muscles, that means SA node, AB node, okay, bundle of His, okay. So from the heart muscles, so it will plot. Clear? It will plot the impulses, okay, on a piece of paper, okay. So that graph is known as electrocardiograph, and the machine through which we can determine this is known as, the total system is known as electrocardiogram. Clear? Now the thing is that what we can determine by electrocardiogram, okay. or electrocardiograph, what we can determine? So the blood pressure is measured from the brachial artery of our hand. Okay. Now what we can determine from ECG. Clear? ECG. So first one, the heartbeat, that is going properly or not. Clear? Then heart blockage, up to a certain limit we can determine. Then heart attack, etc. Clear? Heart attack, pain in cardiac muscles. Okay. Feeling fatigue, okay, etc. Okay. So these are basically a common symptoms of the heart problems. Clear? So that we can determine by watching the graph, okay, whether it is shaping properly or not by the ECG. Okay, clear? Next, what if pacemaker, artificial pacemaker is given to a patient? Clear? Then the pacemaker is working properly or not, that also we can determine from ECG. Okay. In case of artificial pacemaker working properly or not, we can determine from ECG. Clear? Next, the effect of some drugs or medicine on heart, we can determine through from ECG. Clear? Suppose ECG, suppose we have taken some drugs or medicines. Clear? And if that is affecting on our heart, okay, so that also we can determine from ECG. That means our heart rate increases or not. Clear? Any negative impact is there or not, that also we can determine by ECG. Another is there, we can determine the post operational condition of heart from ECG after a heart surgery. After a heart surgery, clear, the heart is working properly or not, that also we can determine by watching the plot, okay, or watching the graph, okay, we can determine from the ECG. Clear? So students, hope you have understood what is ECG, what is electrocardiograph and what is electrocardiogram, and what we can determine by from this particular test, okay, which is very common type of test for the heart, okay, what we can determine, so that you have understood from these points. Clear? Now let us move to the next topic. So students, now let us move to the double circulation. We know our heart consists of 4 chambers. Clear? And where the pure and impure blood are separated from each other, okay, so the circulation system of our heart is double circulation. So double circulation is the combined effect of systemic circulation plus pulmonary circulation. Clear? What is first? Let us. I already discussed what is systemic circulation, what is pulmonary circulation in my previous episode. In short, I am describing, and both these two combinedly is known as a double circulation. Okay. Why? Because in case of a systemic circulation means what? All the impure blood from our different parts of our body. Clear? Impure blood through superior vena cava and inferior vena cava will enter into our right atrium and the pure blood from left atrium, left ventricle will go to different parts of our body through artery or main artery. Clear? So this is what systemic circulation. So in the right atrium, from the lower part, inferior vena cava, it is the vein, it will carry the blood, and superior vena cava from the upper part of our body. Clear? So it will carry the impure blood and it will enter in the right atrium. Clear? And from right atrium, this blood will go to right ventricle, and from left ventricle, clear, the pure blood which has come from the lungs, the pure blood will go in the systolic condition, enter in the main artery, and it will go to the different parts of our body. Clear? So this is systemic circulation. Clear? That means impure blood is entering and the pure blood is going out. Clear? From the left atrium. And pulmonary means what? What happened? The pure blood from lungs will come to heart through pulmonary veins, and the impure blood from right ventricle will go to lungs for purification, through pulmonary artery. This is the exception of the arterial vein. Clear? In case of the left side, the pure blood, will left atrium, the pure blood from the lungs will come to the heart, and the impure blood, clear, from the right ventricle will go to lungs, for purification through pulmonary artery. Clear? So that is what the thing. You see, the same blood is coming and is purified, and then again the pure blood is coming. Clear? And that will again supply to the different part of our body. That means from different part of our body the impure blood is entering to heart. That blood is going to lungs for purification. Again that blood will come into heart. Clear? Pure blood after purified, pure blood, and that blood again will go. That means same blood is circulating 2 times inside our heart. Clear? First impure blood is coming, that blood will go for purification to lung, and that will come again to heart, that pure blood, and from heart again it will supply to the different part of our body. That means that army, injured army is coming, clear, to the camp, main camp, clear. So from main camp he will be sent to the hospital. From hospital he again come to the main camp, and from main camp he again come to the destination. Clear? It will be sent to the destination. That means the same person is coming to the army camp 2 times. Clear? The blood is coming to the heart 2 times. Impure, after purification again it comes. Clear? That is known as the double circulation. Okay. The double circulation is the summation of systemic circulation and pulmonary circulation. Clear? So students, hope you have understood this. Okay. The double circulation you can also copy. Clear? The systemic and pulmonary circulation together is known as the double circulation of heart. Clear? Why? Because the same blood is circulating 2 times. What is the benefit of it? Due to the double circulation, the pure and impure blood are separated. Clear? Pure impure blood will come for purification to lungs, and then again it will go inside the heart, and from heart after purification, from heart it will be transmitted to other different parts of our body. Clear? So that is up to this. Now let us move to the next topic. Okay students, now let us move to the next topic. Clear? Disorder of circulatory system. Clear? Disorder of circulatory system. The first one is hypertension or high blood pressure. Hypertension or high blood pressure. Okay. Hypertension or high blood pressure. Basically, what we know, the 2 type of main blood pressure are there, systolic and diastolic, and the value is what? 120 mm of Hg systolic and diastolic is 80 mm of Hg. That I have discussed in my previous episode. Clear? Now, if the systolic pressure is 140 mm of Hg or more, diastolic pressure is 100 mm of Hg or more, then the blood pressure or condition is known as high blood pressure. Clear? Then the blood pressure condition is known as high blood pressure. So if the systolic pressure is more than 140, clear, and the diastolic pressure is which was 80 in case of normal, it is more than 100, then we can say it is hypertension or high blood pressure. Okay. Basically, the harmful effect is what? It will create a bad impact of our heart, our eyes, our brain, our kidneys. Clear? So a bad impact will be there on this. That's why the pressure needs to be controlled. Clear? So what will happen? It creates a bad impact on our heart, brain, kidney, eyes. Okay. Why the systolic pressure, why the hypertension will occur? Okay. The hypertension will occur due to the decrease of the diameter of the blood vessels. Clear? So the cholesterol will deposited. Clear? So what will happen? The diameter of the vessels, blood vessels will decrease and the blood pressure will increase. Okay. So this is this condition when the systolic pressure is 140 or more than that, and the diastolic pressure is 100 or more than that. So that is known as the hypertension or high blood pressure. Clear? So hope you have understood this. Now let us move to the next point. Okay. Now students, let us move to the next topic. Clear? Let us move to the next topic. So hypertension we have discussed. So coronary arterial disease. Okay. So basically the smaller the medium or the big size arteries, basically if the amount of cholesterol or the triglyceride will be deposited on the wall of the arteries, okay, the medium or the large size arteries of our body, then what will happen? The radius will be decreased. Okay, suppose this is the artery. Okay, so it is a deposition of what, triglyceride or cholesterol. Okay, so this is known as plaque. This is known as plaque. Okay, so what will happen? The radius will decrease. Okay, the radius will decrease. That means the blood, see, the blood now have to flow through the small narrow passage. Okay, so what will happen? It will create a huge pressure. Okay, so if the coronary artery is blocked completely, then the supply of blood to heart muscles will stop. As a result, the heart muscles will die. Okay, so this is known as heart attack or myocardium contraction. Okay, myocardium contraction. That means what? What will happen? So if the level of cholesterol increases or triglyceride deposited, okay, in the artery, then what will happen? The radius of the artery or the passage of the artery will what? Decreased. Okay, then what will happen? The blood pressure will increase. Now suppose the coronary artery, it is totally blocked. The coronary artery which will carry the blood to the blood muscles of our heart will be blocked. Then what will happen? The blood cannot go to the heart muscles. So without the oxygen, because that blood will carry the oxygen clear to the heart muscles so that it can work properly. Okay, so the heart muscles will die. Clear? So as a result, what will happen? It cannot create any impulses. SA node, AP node, they all are creating the impulses so that the heart can contract and expand. Clear? With that energy. So that will stop. So what will happen? This condition is known as heart attack. Okay, or it is also myocardium contraction. Okay, so hope you have understood the coronary artery disease or the what is called heart attack and why it happened. Clear? So that's that is why we should avoid the oily foods. Clear? We should maintain our body weight. We should do the physical exercises, and also we should check our body regular basis, especially the cholesterol level and also the other functions of heart. Clear? So that is very important thing. So this is known as the heart attack and coronary arterial disease. So hope you have understood this. Now let us move to the next point. Okay, students, now let us move to the next topic. Let us move to the next topic. Okay. What is heart failure? Clear? So if the atrium and ventricles both loses its systolic property, then heart can't pump the blood properly. This is known as heart failure. Clear? So what is heart failure? What is the function of heart? The main function of heart is the pumping function. That means it will give a force on the blood so that it can be circulated throughout our body. So if that pumping function is not there, that means the heart cannot work. So it is known as heart failure. So basically the systolic power is the main. Clear? When it is diastole, it cannot pump. When it is in systole, then it can pump the blood so that it can be circulated throughout our body. And when the atrium will systole, then the blood will enter to the ventricle. When the ventricle, two ventricles will be in systole, then the blood will be circulated throughout our body. So if they lose the systolic power, or systolic is not done properly, contraction is not done properly, then what will happen? The heart cannot send the blood or pump the blood properly throughout the different parts of our body. So this condition is known as heart failure. Clear? Now this condition is known as heart failure. Okay, and the next one is heart block. Okay, what is heart block? What we know, SA node creates the impulses. That is why it is known as a pacemaker, that I have discussed in the previous episodes. Okay, don't miss that, see that. Okay, otherwise every episode there is a link. Clear? So I am completing all the portions. Okay, slowly from the beginning up to the end. Clear? So there is a link actually. So what is heart block? So the SA node is known as a pacemaker. Okay. So if the impulses from SA node can't transmit properly to other part of heart, or SA node can't create impulses properly, then this condition is known as heart block. Clear? So what is heart block actually? Because the energy of pumping, from where it is coming? From SA node. It is giving the energy. Clear? Impulses. So the SA node either is not generating the impulses. Clear? Or it is generating the impulses, but it is not carried properly to the all portion of the heart. That's why the heart cannot contract properly. So this is known as the heart block. That means it cannot contract anymore because it is not getting the energy from the SA node. Clear? So this portion is known as, so this condition is known as heart block. Clear? So hope you have understood what is heart failure and what is heart block. So now let us move to the next topic. So now let us move to the last but not the least. Okay, angina pectoris. What is angina pectoris. Okay, due to heavy exercise if the blood flow to the heart muscles decreases, then we feel a pain at the left side of our chest. This condition is known as angina pectoris. Clear? If we do the heavy exercises, clear, then what will happen? The oxygen supply will be decreased as the blood cannot flow or supply the required amount of oxygen. So in the heart muscle, so what will happen? We will feel a little bit pain in the heart muscles at the left side of our chest. Okay, due to the due to the increase of the lactic acid. Clear? So this is known as angina pectoris. Clear to all of you? Okay, so students, hope I have discussed, I tried to cover almost all the topics related to heart, blood, okay, the classification of blood, components of blood, clear, and everything, okay, related to this circulation system, human circulation system. So if you can see all the episodes, then I am giving you the guarantee that the concept will be very clear to you, and any type of questions may come in the examination, you can face, okay, all of them. So we will come very shortly with a fresh and new topic on biology very soon. So keep continue to watch my channel, subscribe it if you have not subscribed it yet, and also share it among your friends, and don't forget to write your comments, okay, in the comment section. Clear? So thank you very much for watching.